Hi, welcome back. This is Nancy, one of the care queens with a hospice care plan. Welcome back to the final video on itch or pruritus, and we're going to talk about medications now to relieve that itch. Again, remember you would have taken all of the general care and treatment that had been done prior. The next step people reach for in relation to overall itching, not associated with a specific disease, would be an over-the-counter medication, and generally people reach for first-generation antihistamines such as Benadryl or diphenhydramine, or Atarax, which is hydroxyzine. These are antihistamines and they block the body's release of histamine, which causes blood vessels to enlarge and causes tissues to swell and inflame, and that causes the itching. The problem with all the first-generation antihistamines is that they can cause drowsiness and, of course, increase the fall risk in our hospice patients. They cause confusion, among other things. They are not good choices for an elderly patient. And I discussed this more in depth in our videos on insomnia. Moving on to pruritus associated with a specific disease process. Prior to hospice care, the medical team may have drawn blood work or taken x-rays in attempts to find out the underlying cause of the itch. If the itch was related to liver or renal disease, we may start a steroid. Especially in our hospice patients, we have limited longevity, so we're looking for something that will get on top of the symptoms as fast as possible. Either dexamethasone or prednisone can cut right into the inflammatory response and be very effective and rapid. A steroid in hospice can also decrease pain, increase appetite, and energy. Remember, these need to be prescribed and dosed very carefully by a medical provider. Now let's talk specifically about patients who have liver disease with jaundice. Why does jaundice cause pruritus? When red blood cells die, they break down and release hemoglobin, which then is further processed into bilirubin. The liver takes up the bilirubin and secretes it as bile. When the liver can't properly do its job, because it's liver disease, then there is more bilirubin circulating in the blood. And then the skin, being the largest organ, tries to excrete it, rises to the surface. This causes that yellowish orange color known as jaundice. But it can also cause this terrible, severe itching all over the body. Often the goal is to remove as much of the bile as possible to decrease the jaundice and then ultimately the itch. Cholestyramine is a cholesterol medication that can help by binding cholesterol to the bile in the intestine. So more is released in the stool when they defecate, and less is reabsorbed into the blood. This decreases the jaundice and the itch associated with it. Naltrexone is an opioid antagonist, but it's sometimes used to treat severe pruritus. It works by blocking the pathways to the nerves that are irritated by bile acids in the blood. Rifampin is a medication which inhibits the uptake of bile, and this can also reduce the itch in liver disease. Let's move on to renal disease. There's a type of itching common to renal disease called CDKAP, or chronic kidney disease with uremic pruritus. It's commonly defined as daily or near daily itching without any dermatological reason for it, and the actual mechanism is just not fully understood. But 40% of all patients on dialysis suffer from it, and interestingly, patients who receive a kidney transplant almost all recover from the itch. So it seems that the buildup of urea is thought to be the main culprit. It can be localized, generalized, intermittent, persistent. It can be worse at night and hot weather, when somebody's stressed. It's just like all the other diseases. The itch can happen at any time. So what do? 2 medications are commonly used for pruritus in renal disease, both gabapentin and pregabalin, better known as Lyrica. We all know them as being important in treating neuropathic pain, and it seems that they have a similar effect in calming the neuropathic itch stimulus. And of course, we know that gabapentin can cause drowsiness and increase the risk of falling in the hospice patient, just as a reminder. One last idea regarding general treatment of severe pruritus. Because the skin is the largest body organ, there is some thought that an oxygen saturation that's less than 90 can contribute to the itch because the nerve cells are not getting enough oxygen. I might point out that adding oxygen to a hospice patient without any signs or symptoms of respiratory disease is not our first step. medications would be used first. I have come to the end of discussing and regarding pruritus or itching. Hopefully, one of the main takeaway points is that it is a very mysterious symptom. It can have far-reaching effects on the comfort of every patient, and maybe more so on our hospice patients who are facing a general overall decline, and we need to have a hope of finding comfort for them in their last week. Please always start with emotional support, good skin care, and then all that topical medications, and then finally prescription medications. I so appreciate you watching, and I hope this has helped you understand itch and what you can do about it. Please visit our website, the Hospice Care Plan. Get our booklet, which has information about all symptom management, help you individualize your patient's care plan. Watch our videos, send in your comments and your questions. That's how we know what you need out there. And remember our motto, care is treatment.